are watching the Jenny Lynn Show, and I am Jenny Lynn Gleave, your host. And tonight, I'm bringing you another great segment. My guest is Dr. Moshe Lewis, and he's a sports medicine doctor. And I'm very glad he's here because I have lots of questions to ask him, and hopefully you will benefit from the answers as well. Dr. Lewis, thank you so much for fighting that traffic and coming here tonight.
Thanks so much for having me. I really enjoy being on your show.
Thank you. I feel that most of us are connected with sports in some way or the other. So tonight, hopefully, the questions that we all have that I can think of on behalf of all the viewers, you can provide the answers for.
That's our goal.
Good. So why don't you start by telling me about Moshe Lewis and why you chose to become a sports medicine physician?
Sure. Well, I was inspired by my mom to go into medicine. She's a nurse by her training, and so she said, if you really want to do this, then you need to go and explore it. So I started volunteering at a hospital and started falling in love with medicine, and then after that, it's one step after the other, and I couldn't imagine that this would happen, but I love being a physician.
Really? That's how you started?
That's exactly.
When did you start going and volunteering? At what age?
Age 14, yeah. So I was just a little tyke, and there was a hospital about 6 blocks away. I'd walk up there and worked all summer and just started finding that people there were willing to help and let me come into the operating room and see operations. For a 14-year-old, that's pretty inspiring. It's exciting.
I would say, and a lot of people are afraid of blood and watching people being cut open. So obviously this is something that you were cut out for.
I think so. A lot of boys are naturally curious, and maybe there's something in seeing that. But also what started to come across was that the people really did care. Literally, they were taking care of the people to get them better. And then there were things I could do to show I care. I was running little errands, going and buying snacks for the patients that couldn't get downstairs, listening to their stories. It started to really help me begin to think of, might there be a way that I could fit this into what I wanted to do as a doctor, really care, go that extra step as opposed to just performing a job. And that's what being in healthcare has allowed me to do.
I agree, that's what it should be. It would be nice if everyone in healthcare shared your philosophy on the whole medicine practice. So tell me, where did you grow up?
Sure. So I grew up in New York, and I grew up in an area called Crown Heights. So inner city, definitely. You're poor. There were drug dealers in that area. There still are. Many of the kids that I grew up with are not around today. So by overcoming some natural hurdles, my mother said I needed to study, and so there were classes that were difficult. Some I had trouble with and had a tutor and took summer school and things like that. But by staying focused and really saying that this is really something that I can do if I keep my mind on it and
Yes.
don't get too distracted by sports and dating and things like that. Little by little, I made it through those hurdles. And I always say that because I want young people to also be encouraged that they really can do anything they put their mind to, but there will be some hurdles to overcome.
Well, that's why I do my show, because I want young people to know that, truly, if you really try at something, chances are you're going to succeed. So what is sports medicine? Is that really a specialty?
It is, and that's a great question because as we are becoming more athletic, as you mentioned in your opening, we're starting to realize that we've got kids at 7, 8, 9 years old already thinking that they're going into professional sports. Some of them, a very small amount, will actually make it, but many of them will play throughout most of their teens. And so we are seeing more and more people being engaged at an early age. And on the other side of the spectrum, senior games are hosted right here or near here at Palo Alto, at Stanford. And there too, we see more and more people in their 60s and 70s and even 80s still competing and still being very active. Someone like myself loves that, but sports medicine really takes care of that entire spectrum of injuries that might happen with the young as well as the older patient.
Okay. So you started going to the hospitals at 14 and checking out the whole scene to see if this is what you really want to do. How long did it take you to get through the whole process?
Right. Well, it is a long process. From there, it's college, of course. So
Yes.
by then, I was already, 22 years old. From there, medical school and then training. So my mother had a very easy saying, another degree and I'd be a thermometer. Because by the time, by the time I finished at 30, I literally had a master's degree in business. I had the MD degree and also another master's in public health. So I've collected a couple of pieces of paper along the way.
That's impressive. Do you have enough wall space to hang them?
I tell you. Well, she definitely was right that I need to go out and get a job. So finally, after spending enough time in school, I realized that maybe it was definitely time to give back. And yeah, every now and then when another updated degree or certificate arrives, I'm not sure what to do with it.
Wow, I'm impressed. So what is the difference between a sports medicine surgeon and an orthopedic surgeon?
Sure. So sports medicine docs, we just don't do surgery. So you mentioned the key word. And the orthopedics doctors, they certainly do operate on patients. These days, those operations are getting simpler, faster, smaller, easier.
Right.
Many of them can be done in the outpatient setting so that people don't have to stay in the hospital a long time. But a sports medicine doc, I primarily see patients in the office. I try to find ways, alternative as well as traditional, to get them better. That might mean acupuncture. It usually means some form of therapy like exercise and physical therapy. But then we also use injections and other strategies to get them better.
Well, I'm glad you brought up the acupuncture, because one of the things I liked about you when I did the research is I noticed that you do embrace some of the Eastern medicine practices. And no offense to anyone watching the show, but I'm an advocate for what they practice because of experience. I mean, I've had injuries where I've gone to the Western medicine doctors and kept going through the same processes and the same treatments and just coming back for more when it's worn off. And then I've gone to see the Eastern medicine physicians, and after one or two treatments, it's like, c'est la vie, it was over. They helped me. And so I want to ask you, what parts, because I've had cupping done, I've had acupuncture done, what part of that do you incorporate in your practice?
Sure. Well, I try to incorporate as much of it as possible. And as you said, I don't pretty much embrace some of them. I embrace all of the Eastern philosophies. Sure, including Qigong, Tai Chi. It goes beyond that to Feldenkrais. So the challenge when I say that is that I certainly can't pretend to be an expert in all these areas. And so I have to flex and feel comfortable referring patients to local experts that do that. And in the Bay Area, I mean, we are so fortunate, that, to have so many influences and so many influential healthcare providers in these different spectrums. Our challenge is to be an advocate for the patient and get them referred through their insurance or through workers' comp to get to that doctor so that they can get better, or that health practitioner. Sometimes they may need the Western approach, and there's a time and a place for it, and the goal is to achieve balance and get the patient quickly better so that they can get back to work or get back to the sport that they love.
I am so happy to hear that you have this, that you feel this way about the entire, the entire thing, because so many people think, I don't believe in that, and they won't even try it. And sometimes all you have to do is try it and see what works for you. I believe some of it works for some people and it doesn't for others. But the goal is to get the person better, right?
Exactly. And you've hit on one of the key elements. Believing that a treatment works or that a doctor cares about you or the physical therapist is going to get you better, that the surgery is going to work, if it comes to that, is a key part of success, a key part of patients doing better. And I think what we're going to continue to see is that Western medicine continues to embrace a broader spectrum, not only preventative, but also in Eastern philosophies, because it does incorporate a lot of mind-body healing, which is often what people need, especially when they have pain. And unfortunately, I do see a lot of patients who have pain.
So you see a lot of chronic pain patients?
Absolutely. There are many injuries that the patient may have compounded over time. Certainly when we have patients that are older, they may have a degenerative process, they may have arthritis. So time certainly doesn't always heal all wounds, and our challenge when it comes to chronic pain is finding the simplest treatment that works the best. You don't want to make a patient worse.
Well, I know for a fact that our minds plays such a big part in our lives, and so many people are oblivious to how we talk ourselves into believing things. And I'm a nurse, and when I was nursing, I remembered, and I did my nursing program in Guyana in South America, where I went to school in my younger life. And some patients culturally believe that if you've got them in the hospital and you're not giving them a huge pill or an injection, you're not helping them. And I remember one night we had a patient, and he just kept everybody awake all night. And one of the staff nurses, because at the time I was a student nurse, told me to go and give him a shot of water, basically. It was a placebo.
Sure.
And I no sooner walked away from his bedside and the guy was asleep. It just blew my mind. So the early time in my life, that made an impact on me. And I've actually tried to work with my own mind and what I believe in, and it's amazing how it changes things and, for you. So I'm happy that you agree with me that people should try stuff and not just be opposed to it just because it's something that's different.
Sure, well, absolutely. You're so young, I couldn't have imagined that you had a former life as a nurse, but I won't flirt. So the challenge, as you said, is that we have to realize that the healing process certainly involves the mind. When it comes to an injury or it comes to pain, that determination to get better, that belief that something, even if it is a placebo effect, will work. Here locally, we're so fortunate in the Bay Area. Sean Mackey is an expert in pain right here at Stanford. I've been to a lot of his talks and consider myself a mentee of his. And he talks about this mind-body connection when it comes to pain and has really done a lot of work showing that we can actually see it on an MRI, a functional MRI. So you're right, it definitely is important for us to realize that we have to help people have hope and not have it false, but really have them believe in the treatments that they're trying.
So do you believe more than in non-invasive treatments? You try those first, and when you've maximized them and the patient still isn't getting any better, that's when you do. Are you one of those people that will only then refer the patient for surgery?
That's correct. In general, you really want to use the more conservative approaches. Some patients do have chronic pain. It may be an injury that heals easier.
Yeah.
I think the challenge that the doctor in sports medicine or pain faces today is really trying to select early on what the patient believes in terms of what may work and getting them to that provider sooner rather than later, because otherwise you can, as you stated, get patients on medications long term or down a pathway where they really aren't making progress. Then patients get frustrated, and then realistically they do have a reason to be depressed, and sometimes a doctor will say that it's all in your head. Well, by that point, yes, sometimes patients are so frustrated that they are literally wound up in pain. So things like biofeedback and really being able to have relaxation therapy, cognitive behavioral therapy can be very helpful to help patients get through those barriers.
Well, have you ever heard of are you familiar with the ARP wave?
No, tell me about that wave.
Oh, you don't know? Okay, I was reading about this when I was doing my research for this
Sure.
interview, and it's where they try to avoid doing surgeries on the knees, and they use this, what they call a ARP wave, but I'm not a physician, so I'm not going to go into it.
Sure.
Maybe we can talk about it on one of our other shows.
Sure, absolutely.
I was just hoping you knew about it so you could share some with us, because it's non-invasive again. And I
Right.
personally believe in non-invasive approaches
Sure.
to treatment.
Sure, there are a lot of modalities, especially in sports, that we use. This one, although I'm not familiar with, are based on usually two principles. One's electricity, the other's often ultrasound, although people hear a lot about lasers, which are essentially just another type of wavelength. So I suspect that it's something along those lines.
It is. So, we've continued to lose athletes to sports. Related injuries, example, concussions, and these are traumatic head injuries that occur from both mild and severe blows to the head. Do you generally treat patients, or do you refer them to neurologists, patients who've had these types of injuries?
Exactly. Well, I have to see them in consultation with neurology just for the legal reasons, meaning that to make sure that the MRI was read correctly and not overread. But these types of patients I see sometimes present in their youth. We have a lot of kids where they are anxious to get back out on the field and play, even though they've been banged around or hit in the head. And my challenge is to have them understand that taking a moment to really rest for a bit before going back out, because that's the biggest concern here with the concussions, that if kids or even adults as professional athletes are having multiple traumatic events to their head, and obviously Junior Seau comes to mind, there is a concern that they really can essentially develop significant brain damage if they don't really have it addressed.
Well, just the other day we had a sports person who committed suicide. And the belief is, based on what I've been hearing from the news reports, is that this person had some depression associated with brain injuries. Can you explain that to me as a physician? What does that mean?
Sure, absolutely. No, it's a great question. The biggest challenge that I think most professional athletes have to at least overcome is, what am I going to do when I retire to civilian life? It seems so simple and straightforward, and many people say, well, if I had that much money, and then they finish the sentence.
Yeah.
But the truth is that you do go from being a superhero to, as they say, Nero, meaning no real fame or people that are looking at you in the same way. They've moved on to the next up and coming athlete. And that's what can often lead to some of the depression. Then financially, sometimes too, that big offset in income, if one doesn't have a job or a business that can be successful, it can be a challenge to really continue to press on and find a new life. So the concern with Junior Seau, because that's who we're talking about in particular, is that he actually really had it together on the surface. The foundation that he was still actively involved in had recently had a charity event. He had been talking to many NFL players, ex-NFL players, who just within the last week or so had nothing but positive and good impressions, no sense that there was something brewing.
Yes.
But I think that there were clues from even a year or two prior when he drove off a cliff after domestic violence charges came forth, that this is somebody who definitely has the ability to get very depressed to the point of doing suicidal gestures, if we pick a politically correct term. So the concern now, and I think the NFL is really trying to begin to embrace this more, is that we need to work, especially with our professional athletes, to help them transition when it comes to these psychological issues. There may be some other things in place, maybe in terms of business planning and financial management, but being able to talk about anxiety, depression, and some of the stresses of transitioning out of the NFL or the NBA. We see a lot of anxiety even in Major League Baseball. Been some athletes recently who had to take off time because they were really stressed, that we need to help them and talk about it. It's okay.
Do you think that they should set up programs where they make it compulsory for them to have consultations with people just to kind of evaluate them? Because men, no offense, and it's not true of all men, but generally are macho, and they don't want to talk about not feeling right or about feeling insecure or depressed. So maybe maybe that would be a good way to screen these guys. What do you think?
Exactly. You're getting at a key element that probably forcing programs on people often doesn't really foster the level of cooperation that we want to see and disclosure, but certainly providing an open environment and also having other players who've dealt with it come forward. Many times when it comes to these issues, being able to relate to another athlete who you can picture yourself as being maybe in 5 years or 10 years and sharing their personal story would really open up that concern that you may have, or in this case of the athlete that may have been brewing, that, like you said, might typically be something, well, I don't want to bother the family with that, and I don't want people to worry for me. And so I agree that the NFL, I think, is going to be looking at many more ways of trying to be a little bit more forceful about making a comfortable environment, not maybe it being completely compulsory, but at least encouraging the athletes to share, let's say, with one another. Sort of a mentor type of program could be another way to do it that wouldn't come across as being too forced down your throat.
Okay. Well, there's, as always with everything in life, there's so much controversy. The other question I wanted to ask you about was the drug controversy, the drug Toradol. What do you feel? What is your view on this?
Sure. Well, as you know, life seems to present controversy, especially when it comes to pain. It's a difficult topic. As you start to talk about it, people start to get to the point that they don't want to listen anymore. They will often offer early suggestions, but if those don't work or you've tried them already, people often are taking medications chronically. The challenge that our young people face is that many of them become dependent on these medications as a way to just escape life. It's quick, it's easy, it can be done behind the closet, in the medicine cabinet, just accessing your parents' meds, for example. And so you're right, we are facing a tremendous epidemic with prescription drug abuse, and we see it amongst the famous and also the not famous. So as a physician, part of my challenge is having patients admit that there is an issue brewing when it comes to the amount of medicine they're taking, and really work with them to go down on their dose and then ideally get off. Many of the patients, that is a tremendous step that similarly a gambler or somebody who drinks alcohol might face in walking away from the table.
Well, you know, a lot of times things get more attention when they involve celebrities. Like Joe Blow down the street could be overdosing himself off and then just croaks one day because he's been taking too many drugs, and we never hear about it. But then it's a famous person, like an athlete or a celebrity of some type, and suddenly it's everywhere. And lately, we've lost quite a few people to drugs. We don't know how they're getting it, but they seem to be getting it.
Sure.
Do you encounter a lot of people that you think are coming into your practice just to get medications?
Oh,
and how do you handle them?
Absolutely. I think every physician that deals with pain, primary care, so many fields, surgery for sure, especially if it's in orthopedics, are faced with literally having to set up their own rules and roadblocks so that patients don't or people don't take advantage of the fact that these meds are available. That means things that don't sound super sexy, like doing urine testing and running DEA checks on patients, really looking for people that specifically have the intention in mind of abusing the medication. And you're right, it's unfortunate that it takes somebody famous to pass on for this to gain more attention, but by the same token too, it allows us to be able to have the discussion, because you can imagine a few years ago, maybe bringing this topic up, somebody might feel like you were really personally offending them to accuse them of being an addict to now people go with a little bit more insight, okay, I understand why you're doing that. Now some may still disagree and walk away, and that's best because perhaps really being in a program where they're monitored isn't something they're looking to do. But truthfully, more and more across the board, doctors are realizing from Florida all the way to California, we have to literally be a gatekeeper, and we've got to identify those patients, and everyone has to play a part in not writing the scripts for them.
Well, it sounds like you can go to Mexico or just go on some websites and buy a lot of these drugs from Canada. So I would imagine it's going to be a really tough problem to curb because of how easy it is for people to get drugs.
It is. In pain and then also certainly recreationally, people have always throughout time, whether it was marijuana, whether it's cocaine or something more current like oxycodone or OxyContin just a few years ago, sought these quick, easy, or in this case, very subtle ways of getting a hold of medications that they shouldn't take just to escape life. And so I think that's one of the biggest challenges that we face. You talked earlier about people feeling macho. The challenge is having people admit that they really are dependent on a drug, and finding a quick solution for a larger problem doesn't work in the long run. That really takes a lot of talking, a lot of talk therapy, and a lot of work. So the goal is to try to identify the patients that need that and really get them through this process. But for most it takes years to detox off the medications and really come to grip with some of the underlying demons.
You know, whenever I'm doing a show like this, I never seem to have enough time. We're almost out of time, but I must ask you this question because there are so many people in America living with chronic back pain. And some of them have really given up on life, and they just feel like, my life is now going to be sitting on the sofa with a bag of chips, watching the Kardashians or whatever shows they really dig, you know? What do you do to help these types of patients in your practice?
That is a great question, because the biggest thing that we can do is literally to try to get them up and get them moving.
Right.
What I tell patients is that doesn't mean that we're going to have them enter a marathon in a few months. We literally may get them into a pool and just have them practice walking there, where often removing gravity allows them to be able to be literally fluid and move many times for the first time.
Right.
Get them into physical therapy to start to stretch them. And also, because weight is such a big underlying factor with pain as well as back pain, as well as people that sit a lot, trying to find ways to help them eat more nutritiously and get the weight down. So it is true, it's a challenge. Many of them will need an injection or something from the West. Some of them have already tried a tremendous array of treatments and feel like they failed. But what we started out the segment talking about in terms of really caring, I think that's what has to come across first, that the physician is willing to walk through this process with them. It's actually going to be a marathon in terms of the amount of time, and that we're going to try to explore every possible alternative that may exist, giving people at least that much hope. Many times that door was closed years before, and that's what also frustrates them. They feel that nobody cares. So that's my challenge, and that's what I exist to do.
Well, I'm glad we asked that question too, because I did work for a spine center and I did encounter some of these people, and they were sent to us because there was a program at this particular clinic that was proven to improve their lives somewhat. They all came through the door reluctantly, like, who are you guys, magicians? What are you going to do that other people haven't done? I'm only here because I was forced to come. So that's why I asked you, because I wanted to know what your approach was to help these people. I think that unfortunately, a lot of them have given up on the system, like you said, and I'm really happy to hear that you are one of those centers that is giving these people some hope, at least to get back to where they can at least do the basics and not just surrender to the chips and the television. So, you know, we're almost out of time, and I want you to tell me what you want viewers to know from a physician's perspective.
Sure. Well, I think that unfortunately, because of so many constraints, one of them being time and other being insurance, patients really don't feel like they're heard anymore. They feel like their doctors are super rushed, that they don't have time to listen. And as corny as it sounds, we really do have to kind of go back to that older school of taking a little bit more time with the patients, but also maybe making the visits a little bit more frequent if necessary, so that patients do feel like they feel heard. We know that we can't spend an hour with every patient. It may literally take that. So I need to, and I try to put those patients, let's say, right before lunch, and it's okay if I take a shorter lunch, or near the end of the day, so that there aren't 10 other people that are waiting. So I feel obligated to find ways to show people that you care, but also to let them hear and let them be heard in terms of their concerns and certainly their pain. It's a process, and what I always pledge to patients is that I'm going to walk through this process with you. I'm not necessarily thinking we're going to always get quick fixes, but I'll be here with you, and I hope that they can hear the sincerity in that.
Well, we're out of time. I thank you so much. I think this was great. I think that you are the type of doctor that most patients need. Guys who are watching this show, you need to find yourself a physician like Dr. Lewis if you're having chronic pain or any of the topics that we covered on today. Please don't just sit there and give up. There is hope. I thank everyone for watching. I thank my crew. I could never produce a show without them. And if you're interested in contacting Dr. Lewis, you can do so through my website. And you can reach me at www.jennylinshow.com. Dr. Lewis, thank you so much. Thank you to my viewers. And hopefully, I always ask and hope that whatever I've covered is going to help your life in some way to make it better. Thank you.